Chase Glenn is a highly regarded public speaker, program director, and LGBTQ+ community advocate with over 15 years of experience advocating for LGBTQ+ identified children, youth, and adults. Chase has been featured in the media, on various podcasts, and in a web series sharing his story and experiences as a trans man. He has served on various nonprofit boards and committees specific to his work in the LGBTQ+ community, as well as relating more broadly to his work in diversity, equity, and inclusion. An Illinois native and South Carolina resident since 2006, Chase holds a BA in religion from Belmont University and an MA in counseling from Webster University. Chase is a Furman University Diversity Leaders Initiative Riley Fellow, class of 2018, and a Liberty Fellow, class of 2023. He and his wife, Colleen, live with their 2 children in Charleston, South Carolina. Chase, I will hand it over to you now.
Thank you so much, Deborah. And there's just something about whenever you hand over your bio and then when you hear it being read back to you that makes you think, I need to edit my bio. And here we are, though. But thank you so much for the introduction and for the opportunity to be here today. I'm going to try to see if I can, there we go, advance slides. I also have the chat up here. I'll tell you a little bit more about myself, but I want to hear while I'm talking more about y'all. I see we have a great group of people in here. I would love to, if you just want to drop in the chat where you're joining from today. If you want to put in there your role, that's great. But I think geographically, at least, I'd love to have a sense of where folks are coming from. And, just, feel free to drop that in the chat as you like. So yeah, my name is Chase Glenn. I use he, him pronouns, and I am based in the Charleston, South Carolina area. I'm currently the executive director of the Alliance for Full Acceptance, which is an LGBTQ+ advocacy organization based here. We were founded in 1998, so we're in our 25th year. And our work really centers around education and community awareness building, as well as advocacy, both at the state and the local level here in South Carolina. I love seeing everyone is from all over the place. It's really awesome to check out the different locations, which this sort of space, it's appropriate that we're talking about the LGBTQ+ Health Education Advocacy Summit we hosted in 2023, and it seems appropriate now that I'm having a memory here of the chat of that event and seeing folks from across the country that were able to join us. So a little bit more about me. I have been executive director at AFA for I guess coming up here on 10 months, but I've actually been the executive director at AFA 2 different times. I was the ED from 2017 to 2021. Then I went and served as the director of LGBTQ+ health services and resources at an academic health science center here in South Carolina and hospital system, and then left there in February of 23 and returned to AFA and have been able to be here now for almost going on a year in the second stint. So that's a little bit more about me. I am, like I said, local based here in Charleston, South Carolina area. I've lived here for over 18 years now. Don't in any stretch consider myself a local to South Carolina, but have been involved in LGBTQ advocacy work for almost all of those years in some capacity, whether professional or in a volunteer sort of capacity. Something to know about me, it's not necessarily integral to what we're going to be talking about today, but I am a trans man. And, so a lot of my work, honestly, I come to this work and I bring my own personal identity and experience to the table. And I know for me, as a trans man, living here in South Carolina, personally, I've experienced, issues and barriers when accessing healthcare and when accessing, health information and medical information. I personally have experienced discrimination, and I know full well That's just a fraction of the experience that other members of our community have had. And so for me, thinking about access to healthcare, access to to information that's accurate and trustworthy, I know for myself personally, that's so important and has been something that's been a challenge. And so it's just one of the reasons why we advocate in this area around access to care. Um, Let me I'm going to jump right in here. And I realized I'm kind of looking at the slides that I had on here. And so a little bit more about organization. One of the projects that we took on, and I'm kind of giving you a little backstory here, how we ended up getting to the point where we hosted the LGBTQ health education advocacy summit in 2023. The run up to that was, similar to what I just shared about my own personal experience as a trans man. There wasn't a whole lot of data that had been captured around the lived experiences of LGBTQ plus people in our, in South Carolina in general, and then, drill down into the Charleston Tri-County area. So our organization, this was back in 2018, so pre-pandemic, partnered with the College of Charleston and Medical University of South Carolina to conduct a community needs assessment. And we went into this thinking, well, honestly, I thought, well, if I could get 200 people to respond to a survey and share with me, some of their lived experiences, I feel like, wow, I'd have a really great, much better sense of kind of where people are. I know what my experience is. I know what about the experiences of the people around me, but I really wanted to get a broader sense of what people were, experiencing and what was impacting their day-to-day lives. We ended up having almost 1,500 people respond to our survey. And these were people who are 18 and older, identify as LGBTQ, somewhere within that sort of umbrella, and lived in Charleston, Berkeley, or Dorchester counties here in the Charleston, South Carolina metro area. So nearly 1,500 people responded, and we captured information on all types of, all sort of areas of people's sort of lived experience. So everything from family support to social connection, mental health, healthcare access, experience in religious communities, sense of like public safety, interactions with law enforcement, very broad. And I would say personally, what I walked away with when we published this report in 2019, some of the most impactful data for me was around healthcare. And part of the reason why I went and took the job I took, working, in an academic health science center and hospital system here in South Carolina, was because whenever we captured this data on access to care and just very basic experiences within healthcare for members of our community, we found that there were some just really foundational things that were just off for members of our community. First and foremost, we realized that, people weren't, their sexual orientation, gender identity data was not being captured consistently across the board. In fact, of our 1,500 respondents, over 40% said their providers didn't know their sexual orientation. 50% of our non-cisgender respondents reported their providers didn't know their gender identity. So really basic sort of core, pieces of information that providers didn't know. Our respondents said that more than 1/3 felt like their providers didn't know the answers to their questions. We got in the qualitative section, one person said, my doctor hadn't even heard of PrEP. And this is, for anyone who does any work around LGBTQ plus health, very, again, building blocks of basic healthcare for LGBTQ folks, and really for anyone, but especially when it came to our community and the needs of the community. We were starting really what we felt like was on ground zero. We were looking at, a healthcare, workforce that just honestly didn't have a lot of basic understanding and knowledge around the needs of the community. And that didn't even take into consideration sort of the climate that we all were going to move into post-pandemic, when we saw a surge in legislation across the country that meant a lot of which worked to limit access to healthcare. And so even just in 2018, 2019, we saw just really significant need within our community. This was a quote that we got from within the survey. Someone said, "I don't think I've ever had a doctor proactively ask me about my sexual orientation or gender identity. If they don't ask for this basic information, how can they know how to treat me?" And that really stuck with me because, one, as a trans man, when I read that for the first time, I had the same experience. At that point, I had never had any provider ever proactively ask me questions about my sexual orientation or gender identity. And I can actually say it was only within the last year that I had a provider ask me that question unprompted, like just as a part of their general intake, a new provider. And that to me kind of gets to, again, just sort of the significant sort of gap in understanding and knowledge as it pertains to why, this sort of information is important, what the needs of the community are, how healthcare for LGBTQ folks is the same as healthcare for everyone else, maybe how it's unique and different than other folks. And just a real need for knowledge and understanding. So fast forward to 2023, and that's a big gap, I realize, but the Academic Health Science Center that I worked for previous to returning to AFA actually hosted a summit much like this, where it was a forum where providers, students, a lot of librarians, I love our librarians, community members were able to come together and just learn some basic information about LGBTQ health. And we had speakers come in, various specialties, various sort of topics and areas of interest. And the idea really was, let's just try to get more information out there about LGBTQ health. That sounds really basic. I realize as I'm saying that out loud, it kind of sounds ridiculous, actually. But this is what we're working with here in South Carolina in particular. We didn't feel like there was any source where people could come and gather this, hear from thought leaders, hear from experts, and have an opportunity to interact in a way where they could get questions answered and such. Well, as we proceeded beyond the 2022 summit, we learned that effort wasn't necessarily going to be supported any longer within the institution. And then the Alliance for Full Acceptance, through my leadership, was interested in sort of replicating a similar event. And that's when, through our connection with NNLM Region 2 folks, we were able to seek out and receive a grant to support this effort. And I want to just say, we wouldn't have been able to do this event and execute it the way we were able to without the support of NNLM. As a nonprofit organization, we are constantly having to fundraise, right? I mean, that's just the reality of work in a nonprofit setting. And when you have a new program idea, that funding doesn't just magically appear, even though you have the idea. You have to go out and find that funding. And NNLM folks were very quick to respond and say, this is something we want to support, and however we can do that, and really plugged in. And not only was there the financial support, there was the support through the programming. And I'm going to talk about some of the ways that we engaged with NNLM staff to help make this a successful event. So again, really, this was about connecting providers, students, educators, librarians, community members, anyone who had any desire to increase their knowledge and understanding around either the needs and experiences of LGBTQ folks or the intersections that with LGBTQ identity that can, as it relates to healthcare in particular areas. And so we ended up hosting this virtual event for 2 days in March of 2023. And we ended up, and I have some slides that go into sort of the demographics and kind of where we landed on it. And I won't get there too quickly. But, really when we were sitting down and planning the event, we were just thinking, number one, we wanted it to be virtual because that felt just as accessible. It was just a very accessible way for folks to join. We've gotten feedback since the first year that, people said, well, I love the virtual format because it made it so that people from across the country could join. But for people who were local and even just in our state in general, there is a desire for an in-person sort of gathering, because I think there is something that, this tangible piece of being together in a room. So future formats may be something beyond just virtual, but for us in 2023, we planned 2 full days of virtual programming. This was what was on our website here. I'm not going to just read this because it literally is just pasted off of our website to describe the event. But we had keynote sessions at the beginning and end of each day, and then we had breakout sessions in between. 8 breakout sessions, but there were 16 options for folks to choose from. And again, this was attracting sort of different people from different sectors, and so we knew that some people were going to be at a very 101 level where they needed the basic information, while others might be a little more advanced, a little more well-versed in the topic and the conversation. So we wanted to have, options for both groups of individuals who might have different needs and different desires as far as the knowledge goes. We launched a website. This seems like really basic, but we knew that we couldn't just magically expect people to just show up to an event if we just talked about it and maybe emailed a few people about it. So we launched a website, and we did then use the network. NNLM was fantastic about sharing it out to folks. We were able to connect with a number of networks, and I have to laugh. I've told Deborah this story before, but it would be funny. I would, share it with Deborah or share it with someone else, and then all of a sudden, there would be this strange surge of librarians from across the country. We get these registrations would start rolling in, and it would just be very clear where they came from. And I loved that because I just always felt like they were always there to show up for us and support us. I can't, obviously our friends at NMLN have made that happen and made that possible by getting the word out through the network. Our website, it was pretty basic and simple. We knew we just wanted to be able to get, the schedule up there, get, the list of speakers up there, and a registration page. For registration, we offered up, and I'm actually going to, I think the next slide here is, well, I'll get to the registration piece in a second then. But really our goals for the event, I've already gone through this sort of, but we wanted an accessible space where people at any level of understanding and cultural competency could find value in the content. We wanted to bring together thought leaders. We didn't want, we didn't mind having just the average person. We had plenty of average people like myself who were doing sessions, but then we brought in some really well-known speakers and authorities on the topics that we were covering around LGBTQ health for elders, trans care for adolescents, gender affirming mental health care, lots of different topics. We had a session that was specific to, when we talked about advocacy, specific to sort of the different legislative issues that we're seeing trends across the country in different states that were impacting LGBTQ folks. So we really wanted to bring together a well-rounded group of people who could speak with authority on these topics. And then the last bullet point there is begin to build a network of LGBTQ plus culturally competent providers in South Carolina. And I have an asterisk there because, that's kind of unique to us. But something we, think back about the survey data, finding out that so many people didn't feel like their providers knew them, knew their needs, understood them. So many people didn't feel like their providers really could meet their needs, and knew the answers to their questions. And so, and it resonated with us because we also knew that we constantly got, phone calls and emails from folks in the community saying, I'm looking for a new primary care physician, or my daughter needs an endocrinologist. Do you have a recommendation? Or I'm looking for an LGBTQ identified therapist because that's who I feel most comfortable talking to. Do you have any recommendations? And we were sort of, we were pulling together lists and sort of, lists of resources and people that we could, vet and provide to people. But we knew, the bulk of the people that we had were Charleston area. We were getting calls from across the state. And we knew also that, again, we had this sense of, we were entering a time, or we were in the middle of a time, really, as we were planning this event, that some providers were, I'm trying to think how to say this. There was more hesitancy, I guess, on the part of providers to be so public in their support. Some providers point blank told us, I don't want to be on a list on your website. And at first I heard that and I thought, oh, that doesn't feel good. Why would I ever want to recommend that one of our community members go to a provider who says, I don't want to be on a list on your website? Like, they're embarrassed. But really, I think we just have to be honest about the reality, the current climate that we're in, where there are literally people who are targeting healthcare providers for LGBTQ community members. There are people who are trying to trap them and say that they're doing something they're not supposed to be doing. So we're in this really sort of strange time. So we kind of thought, well, in addition to our work that we're already doing to sort of build lists, what if we hold this event and we, as a way to begin to build that network of providers across our state. And again, this is specific to our mission as an organization, so that we were kind of creating a structure to support our community when we knew that politically we were headed down a path where, they were going to be throwing walls up, pretty regularly here as far as access to care. And I'll say now, we are planning to do this event again this year, 2024. And we're now thinking we're going to probably be doing this in the fall because it lines up better with the legislative calendar and our work there in the legislature. And we're thinking we're going to take it one step further in that sort of and I'm going to use this word in quotes, but sort of a certification, if you will, kind of a track that if a provider wants to go through 3 breakout sessions on that really sort of lay that foundational sort of information and knowledge down, that then we feel confident that we can put them then in our resource list and provide their name. And it's a little more of a formalized structure in how we can, I keep using the word vet, and I don't really want it to sound like we're gatekeeping, but do our due diligence to make sure that we're providing the names of healthcare, mental health counselors, healthcare providers who aren't going to harm our community at a time when our community is already in a vulnerable space. So those were kind of our main goals going into this event, accessible space where anyone could find content that was applicable and meaningful to them, bringing thought leaders and experts together with where folks can interact with them, and then third, helping build this network of providers. Thank you, Deborah. I appreciate you putting that. I should have said at the beginning. Feel free to drop anything in the chat. Would love to hear questions or even just comments, or if you feel like, wow, something Chase just said does not resonate at all and I'm having trouble with it, feel free to drop that in the chat also. So going into this, this is very sort of practical information, but if you're like me, I like to just, have it mapped out very basically for myself. So I know when I'm going into something kind of what to expect. We didn't come into this thinking we really want to make money on this event. We just wanted to be able to pay for the event. And we really wanted it to be accessible. Again, that was one of our first goals. So while we did have registration fee options, while we gave folks an option to to register, at either the full cost, which was only $50, or a reduced rate, which I think we had a student rate that was $25. And then we had a free rate that you didn't have to give us any reason, but it was just a reduced rate. And people could either name their own cost or not pay anything at all, and no questions asked. But that way, we could give people the opportunity to attend, and we didn't want cost to ever be a barrier. And again, wouldn't have been able to do that without the grant from NMLM. They absolutely made that possible. We also received a grant from the Freeman Foundation, which is a foundation that funds LGBTQ organizations, and they were very excited about this event and provided that grant. Out of our registrants, we probably had 50% that paid something to attend. Not all paid the full $50. I would say maybe only 25% paid the full $50. But this way it allowed us to be able to offer this up, at no cost or low cost to folks. And then our expenses were pretty basic, to be honest, because we kind of handled it all on our own. We set up a website, like I said, that was relatively cheap. We upgraded our Zoom. We did we looked into using some sort of fancy webinar or conference, software platform. It's all very expensive. And to be honest, I think a lot of it doesn't always even work, or it's more complicated to run than maybe it's worth. And knowing that we were a pretty bare bones staff, our organization, I'm the one full-time employee at this time. We have another couple staff people that are part-time. We have a lot of volunteers in the mix. So I needed something that was easy and familiar to folks. So we just upgraded our Zoom account and got a professional account where we were able to, we could have, 1,000 people come in there. And we did that upgrade for like 2 months so that we could host the event. And then we provided honorariums to the speakers. And honestly, the honorariums were the most expensive. Obviously, you can see that. But that was, the biggest line item. And, with the honorariums of speakers, you're always walking this line. But what I found is, I would tell someone about the event, and they would hear, we're a nonprofit. They would hear South Carolina and understand sort of what that meant as far as the climate in South Carolina. And, so many of the people that do this work that are experts in this field, they do this, because they're really good people, and they want to, they want to, support the work, right? And they, so many people would want to give their time away for free. And I was having to tell people, no, we absolutely want to, while I can't compensate you at your exact value, I want to at least compensate you. So we were having, in some cases, basically tell people, no, we have to give you money. We don't have to, but we want to give you at least some, token of appreciation for your time and your expertise. But, if you could do the math there, to have 4 keynote speakers and 16 breakout sessions and only have honorariums at, just over $11,000 is pretty incredible. Anyway, a lot of generosity of folks that came in and spoke with us. So that's kind of, how that netted out. All right, so now I was just going to give you kind of I was just going to show you sort of our schedule, so you get a sense of the type of topics that we were covering. We really, again, some of this was about bringing in experts and people who were names that people would recognize, but some of it was just about even, just highlighting some of the local and regional folks that we had here that we know are experts. That maybe don't have the same name recognition, but we just are excited to be able to have them in the mix. And, we started out with some relatively kind of the 101s as we started out the summit. And, here, Deborah was a part of one of our first breakout sessions and speaking about, beyond the binary and talking about, the gender binary and, how that impacts how we, just in regular life, how we're interacting with folks, but then also when it comes to LGBTQ care and thinking about those sorts of topics. And really did a fantastic job of highlighting so many of the resources that are available through the NIH and NNLM and a lot of publicly accessible, trustworthy information that I think the average person doesn't even know is out there. And they did such a fantastic job highlighting those resources and showing that the relevance of the work that is happening at NNLM and the NIH. We talked about everything from here. I would just say like effective and affirming communication, and that was really just about how are we opening up our language and being inclusive. Primary and preventative care for trans folks. I mean, that is seems really basic, but whenever you get into the in the mix with people who haven't necessarily been a part of conversations like this, we got a lot of feedback that people found that really helpful because so often transgender healthcare is positioned as this really specific specialty. I mean, even me as a trans person, I've heard that. I've had providers say, oh, now as soon as they found out I was trans, that now all of a sudden they felt like this was specialty care and they weren't equipped to provide it, when I really just needed a physical and needed someone to go to when I had a sinus infection. This wasn't specialty care so much. So how are we, how are we meeting the needs of the trans community and providing care in a competent way? We then had, some focus around, rural LGBTQ plus adults. We had some researchers from University of Minnesota present on that topic, which was something we actually had people had asked for topics around rural healthcare, rural populations within the LGBTQ plus community, because so often the studies we see, the presentations, the data that's out there, anytime there's anything that really highlights the community, so often it's coming from a more metropolitan area, big cities. And for those of us who live in parts of the country where the majority of our state is actually in a more rural setting, that looks different, right? That while the healthcare is the same, how you access it, your access to resources, and so many of sort of the things that come into play in accessing care can be impacted by being in a rural space. I mean, just very basically, I mean, in South Carolina, there's been a lot of talk around, just in general, limited access to specialty care. And when I say specialty care, I mean like OBGYNs. We don't have an OBGYN in every county of South Carolina. And then when you think about, I always I don't mean pick on, but I always sort of call out certain counties that always come to mind to me. There's some are more rural counties that if a member of our community is looking for a provider and they live in Allendale County, South Carolina, that is extremely rural. And maybe there's only one or two physicians that provide, will be a primary care provider in that county. And if you're running into the fact that one of them and maybe both of them aren't really sure that they even want to treat LGBTQ patients, you're running into a lot of issues when it comes to access to care. And for many members of our community who experience employment insecurity, housing insecurity, lower wages, access to resources are limited. Driving 2 counties over to go to a healthcare provider may not be feasible. And so for a lot of folks, they forego care altogether or they delay care. And then when we think about health outcomes, that absolutely plays a part in those negative health outcomes. Then we had some mental health related sessions. Garrett Conley was our closing keynote on day one. And if you have ever heard seen the movie Boy Erased or read the book, Garrett is the author of that book, is currently a faculty member at Kennesaw State University in Georgia. And he really was very generous with his time and came and shared some of his story as a kid growing up in Arkansas and going through conversion therapy, which, depending on where you're located, you may think, well, that doesn't really happen anymore. But I know for sure, we know it's happening here in South Carolina, where there are therapists that are practicing this conversion therapy on a day in, day out basis, trying to, change LGBTQ people. So his story was really powerful, and we really appreciated that. And then day two, we were going into the session. We talked more specifically about LGBTQ advocacy in South Carolina. Colleen Condon spoke about some of the laws specific to the trans community, legal name changes, gender marker changes, and how that can impact. I mean, there's a direct tie there with thinking about accessing healthcare and how that can impact your access to care. Gender affirming surgery, that is just a reality of having discussions around trans care. And Blair Peters is a physician out of Oregon who is really just an incredible speaker and physician, and really an authority in a lot of ways around these conversations. And he was able to bring just some of the most up-to-date information. We had a session related to intersex identity. Oh yeah, sorry, Jennifer. Yes, the name of the speaker regarding conversion, Garrett Conley. I can go back here and see. Oh, nope, that's not how that works. There we go, Garrett Conley. Garrett, Garrard Conley. Had a session that was related to people who are intersex and sort of bodily autonomy and what that means in healthcare for people who are intersex. It was a really incredible session from Sean Saifa Wall. And then we had more sort of advocacy related sessions related to the legislative update, some general best practices, and I'm literally just reading through these, and that doesn't feel good. So, but as you can see, the main point here being that we really wanted to, again, provide a very sort of broad kind of overview, hit a number of different topics, come at it from several different sort of levels of knowledge and understanding. But really, hopefully, meet somewhere in the middle so that we were able to capture the needs and attract, people from sort of across the board, from the person who's never had this conversation before, never even thought they needed to think about this before, to maybe the person who is leading this effort in their organization and, is trying to learn sort of the most, the latest sort of data and information around these topics. So, it was, that is always a tough sort of, threading that needle can be difficult, because you don't want to leave either side of that equation feeling like they didn't really get content that was beneficial to them. But based on our feedback, we really felt like we had, done a pretty good job hitting the mark. So this is sort of our report out on, how the event went. We had over 200 unique attendees over the course of the 2 days that we did the virtual programming. That is the one great thing about a virtual space, is some people would join just some sessions that interested them. Some people would join all the sessions. I got to see some very familiar names throughout the 2 days. And sometimes there'd be a name and I'd say, I have not seen them the entire time, and now they're here. So that virtual space gave us a way that, again, increased that accessibility, and that we had people, coming throughout throughout the 2 days, and they didn't necessarily have to stay for all 2 days. 8 different states that were represented in the survey responses, but in going back and looking at the attendance logs, we know that there were 24 different states that were represented within each of the sessions. So that was pretty incredible to know that, while our immediate sort of goal was to reach people in the state of South Carolina, we know that we also had influence and we were able to reach people from outside of our state and 24 states across the country with this sort of experience and information. We averaged around 85 attendees per session. So we felt pretty good about that. Again, not really having, being a small nonprofit organization, not having necessarily the backing of some major institution or something that gave us, instant credibility or name recognition, but really just saying this is a need that we saw that we wanted to fulfill. We felt really positive as a first year doing this event, having this sort of response. We did a survey at the end, and we asked our attendees to rate their knowledge and understanding of issues impacting LGBTQ individuals and their access to care. We asked people to sort of rate their knowledge and understanding before the summit and then after the summit, and gave them a scale, very little knowledge and understanding to extremely knowledgeable. But people ranked themselves and rated themselves and said 28% said they felt knowledgeable to extremely knowledgeable before the summit. But then after the summit, people reported out that 92% felt knowledgeable to extremely knowledgeable. So we felt like that was a pretty good sign that, we were, scratching the itch that was there and that we'd actually created some content that people were finding helpful. That was really encouraging for our leadership to see, our board members and the funders also to know that people were reporting this sort of move in their knowledge and understanding. When we asked people whether or not the summit met or exceeded their expectations, 99.8% said the summit met or exceeded their expectations. That's pretty good. I felt very good about that. And then 100% of our respondents said they would be interested in attending the summit again if we held it again. And that's a pretty good endorsement. Felt like, again, as a nonprofit who we don't do events for a living, this was a new thing for us that we had pulled together. We felt really positive that was just the general experience that people had at the event. And this is actually my last slide, but I want to leave time for some Q&A and conversation. But, we asked people, of course, wanted to hear kind of their thoughts and the experience. And these were two quotes of several that we received. And you can obviously read them for yourself, but I'll read the first one here. I learned so much, and I have a number of actionable things our clinic, will work on to make our work more inclusive for all, ranging from changing our intake forms, our EPIC templates, to doing group training in the future. And that, in a nutshell, to me, felt like that was a huge win, because when I was picturing the person that I wanted to show up and the takeaways that I was hoping that they would leave with, very actionable items. That's what I wanted. It was great if people wanted to come together, learn just for the sake of learning, and walk away feeling like, wow, I'm so glad I learned that. And that's great. I feel good. I mean, that's good. But to me, as a nonprofit leader who's really, based in the community and interacts with the community on a day in, day out basis, I wanted people to leave with actionable things that they could work on and ways that they could improve what they were doing in their clinics, in their offices, in their practices, at their hospital. That's what I was looking for. I wanted people to leave feeling like, I now know there are 3 things that I can do that will make the experience of LGBTQ plus people seeking care better. And hearing that is exactly what some of our attendees found and learned was great. And then this quote: "The summit exceeded my expectations. I appreciated the honesty and vulnerability of the speakers, gained valuable information and resources I can take back to my work, and felt in a place of community." And I thought, the reason I picked this quote too was because I think in all of the planning and organization and all of my ideas and our organization's ideas about why we wanted to do the event, why we thought it was important, I didn't really have on the list community. And I think that really sort of speaks to not just the moment we're in, but I think it is a part of the moment that we're in where there's a lot of isolation, and people who are either members of the LGBTQ plus community or supporters and allies often feel isolated, often feel like they are maybe alone in being the champion for this work. Oftentimes people find themselves as the only one, or one out of just a small group of people who are advocating and pushing for change and pushing for greater inclusion within an institution. And so when people are able to come together, even in a virtual setting, if it was in person, that'd be wonderful. But even in a virtual setting, to hear from speakers, to hear topics that are important to them, but then to be in community in a way with a group of people for a time that have similar desire to learn, and where they could ask questions and be real. And I thought also, the speaking of the honesty and the vulnerability of the speakers, that was not at all really on my radar as to something that maybe should be a goal for the event. This creating, for a moment, creating community for people who are either doing this work, who are impacted by this work, or who have a desire to potentially learn more and do this work. And that was a really pretty cool byproduct, I think, of the summit that was unexpected for me. But I think going forward, if we choose to do this again, which we are going to do this again, that it'll be something that's more sort of forefront in our planning, and thinking about the spaces that we create and how are we creating that sort of community that folks do need. With that, I am going to take a pause here, and I will actually even stop sharing my screen, I believe. And I was looking at the chat. I don't think I saw any other questions come in, but just again wanted to say thank you for this opportunity to speak, and thank you to the NNLM for believing in our organization, believing in this work, and understanding the importance of this. That I get caught up sometimes in thinking, well, I'm just one person, or we're just one small organization. This was just one event. But the reality is that's what it takes. It takes one person, helping another person. It takes, one team to lift up the priority, one leader, one event like this. These are what the things that come together, that compound, and that can create real change. And while I can't, go out and conduct a survey today like we did in 2018, and I don't know that we would see this incredible improvement, to be honest, because I think we're constantly fighting against forces that, to be honest, have targeted our community very intentionally. So while we may take steps forward, they're constantly pushing back on us. But I know that we just keep doing work like this. We keep trying to create spaces where people can learn, improve their understanding. We can create spaces for our community to come together and find connection, and receive care at a challenging time. And we couldn't do that without support from organizations like NNLM and the NIH for being supportive of this type of work. So for that, we're so grateful. And Deborah and Deja, you are the faces of that in this moment. So I want to thank you all for being on our team and supporting us.
Thank you so much for the work that you do. It has been a pleasure to work with you. I couldn't ask for a better experience, nor could our region. I tried to see if there were any other like questions or comments. We did have a comment come in. It's always so wonderful to hear stories like this of joy, success, and community. And you got thanks for sharing. And I completely agree with that. It's been a beautiful experience. I don't see any other questions in the Q&A, so I'm going to assume that maybe there aren't any, but I did want to remind you guys, if you are regular Region 2 webinar folks, the CE credit and survey work a little bit different. You'll do it through VFairs, but that's just something that you'll do through the platform. I cannot say thank you enough to Chase for this, sharing your work with us, for making this a wonderful experience, and for making a difference. Thank you all for your time, and I really appreciate you, and thanks especially to Chase. Take care, everyone.
Thank you all.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.